DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. Today's show is going to focus on diagnostics in cattle. We're going to talk about everything from finding the right animal to taking the right samples and getting them submitted correctly, and then working with your veterinarian to implement change. Thanks for watching DocTalk, and we'll be right back.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson. I'm glad you joined us. I am a veterinarian with Production Animal Consultation, PAC, and we cover feedlots, Colorado, Kansas, Nebraska, Iowa, beyond. We have cow-calf network where we have veterinarians all across the United States that are working together for a common cause, and that is to make lives better and make an impact on lives through veterinary medicine. And so as we continue looking at ways to improve upon the things that we do in the field, and as we start to talk about beef cattle production medicine, individual animal medicine, you know, the big thing is diagnosis. My dad, when he was in practice, used to say it was easier as a practitioner to sell a vaccine for a few $1,000s than to sell a diagnosis for a few dollars. And we get caught up in this. We send in a sample for diagnostics. It comes back with one bug on it, and then we're going to vaccinate for it because we're never going to have this happen again. And it just doesn't work that way, whether we're talking about viral pathogens or we're talking about bacterial pathogens or other. And so really, whenever we have an opportunity to get a proper diagnosis, I think that's where we have to start. And I really encourage you to work with your veterinarian at the beginning of an outbreak, not after it's been going on for a while, because it's no different than anything else. We have looked time and time again, whether it's Dr. Shane Terrell's research on lameness or whether it's the 10,000 papers on bovine respiratory disease. The earlier we intervene in a case on an individual animal, the higher the likelihood of a positive treatment success. So pulling the animal early for lameness, pulling the animal early for bovine respiratory disease equates to improved case fatality rate or improved case outcome, okay? On a herd level, it's at the beginning, having someone come out as we start to see issues, getting on top of it as a herd, rather than waiting until we have a bunch of open cows or waiting until we have increased death loss across the board. Veterinarians are trained diagnostically, but as we start to understand not only the shortage of veterinary medicine practitioners in veterinary medicine, but veterinarians can't be at all places all times of the day. And there are some things that we can do to help with diagnosis, whether it's disease diagnosis, pregnancy diagnosis, surveillance of pathogens coming into or out of an operation, that we can work together to train people to be certified samplers or to take samples in the absence of a veterinarian to get it done in a more timely fashion, or bring them to town and have them mailed in from the veterinary clinic. Not only will we be looking at endemic diseases, but we could be training a workforce and the cow herd to be ready in the face of a foreign animal disease so that we can get samples earlier rather than waiting for people to show up on premise, have a more timely diagnosis, get things mailed out, and prevent people from being quarantined on your site. So when we come back, we're going to talk more about diagnostics. We're going to talk more about training at the level of the farm and its importance and its relevance. You're watching DocTalk, and we're glad you joined us.
This Cattle Intel is brought to you by Neogen.
Hello there, Dr. Nick Wagner, Professional Services Veterinarian with Neogen here today, and just wanted to take a brief moment to talk about water access in feedlots. And with that being the case, you want to make sure, based on the size and number of cattle in your feed yard, that they have free access to water at all times. You want to make sure that those water sources have the proper flow to be able to provide adequate intakes for those animals, because the other big thing with water is that the water intakes will directly impact feed intakes on those cattle. And so if you're not able to get the amount of water those animals need or get them access to water, especially in the heat of summer, you're going to have trouble with the health and performance of those animals. And you also want to make sure that you're keeping a close eye on your tanks within the feed yard to make sure that you're keeping them clean and avoiding any sources of contamination, which also could have an impact on the health and productivity of those animals in your feed yard.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
Hey folks, Dr. Dan from DocTalk here. We have some exciting news. We're pretty pumped about it. We'll be on Rural Radio, channel 147 on Sirius XM. We will be on the air at 9 a.m. Central Standard Time, 10 a.m. Eastern, 8 a.m. Mountain. Also, you can find us on the Sirius XM app. Thanks for watching DocTalk. Now thanks for listening to DocTalk, and we'll see you down the road.
From the veterinary standpoint of it, we all know that stress is a precursor to a lot of other underlying diseases. The cells in the animal's body at different points can react differently to the vaccinations or whatever we're giving them. So if we can create an animal that is less stressed, 1 pound will pay for the whole cost of the therapies right now.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here, and I'm with Production Animal Consultation. Also an emeritus professor at Iowa State University and adjunct faculty member at Kansas State University, two universities that are near and dear to my heart and done a lot of things for me and my family over the years. We're talking about diagnostics. And the first thing on diagnostics is being able to find an animal that's ill or injured. And when we're talking about bovine respiratory disease and we're walking through the pen or we're walking through the cattle, you know, the first thing I'm looking at is off feed. And so I'm looking for animals that are off feed. I'm looking for animals that are isolated. Depression is another one. And when we look at the acronym DART, depression, anorexia, respiratory distress, and temperature, rectal temperature for the acronym for bovine respiratory disease, that animal that is depressed, their head's down, their ears are down, they're not paying attention to you, they're not coming to feed, they're anorexic, they have a gant appearance to them. And then respiratory distress, increased respiratory rates. A dry nose on a calf is equivalent to chapped lips on us. We want a wet nose on a calf. When we start to see a dry nose on a depressed calf with sunken eyes that's dehydrated and not eating, we got to get them in and do a clinical exam. Lameness, you know, as we progress, the back foot should land where the front foot leaves. If we start to have short stride where the back foot doesn't reach it, we're having mild lameness, pulling them early. As it progresses, we start to see the head bob and the buck as the animal starts to move. And then obviously when it's three-legged lame, we're probably intervening pretty late. But there are tools and technologies out there. Obviously, we have herdsmen that are incredible at finding ill and injured animals. But as technology is improving and as opportunities present themselves, you know, things such as SenseHub and products out there that can identify the animal's movement during the day and the animal's body temperature. What these types of technology are really looking at to improve your diagnosis and diagnostics is that it's looking for an animal that's not conforming or not acting the same as the rest of the herd. So in a feedlot situation, you know, we're going to have normal activity. The animal's coming to the bunk, going to the water tank, laying down, coming to the bunk, laying down, going to the water tank. It's pretty much what a feeder steer does. Well, the one that doesn't is going to have much decreased activity. Or if there's one that has something else going on that increases its activity, whatever that is, we're trying to identify abnormal. And then obviously with body temperature, whether it's through a bacterial infection or a viral infection, what we're seeing today with these wearable technologies is that we can identify animals 4 to 6 days earlier than what the person with the naked eye can understand. And so remember, earlier intervention equals better case outcome. And the other thing that I've noticed is that the feedlot crews that I work with and consult in yards, when we're using these wearable technologies, their eye becomes trained to understanding better what the computer's saying to pull. And so these wearable technologies, the best AI tool in the world is our brain. And all the computers are trying to do is simulate our brain. And when we can start to see what that machine would pull or what SenseHub would pull, the people inherently start to see that in their own brain and saying that animal needs pulled, this animal needs pulled. And it really has improved our pull rates across the yard, not just in the pens in which the wearables are deployed. So we're going to take a break. When we come back, we're going to talk about taking those samples on antemortem, and then we'll talk about postmortem. You're watching DocTalk, and we're glad you joined us.
Every farmer knows that understanding the landscape is the most important ingredient for success. When it comes to investing in precious metals, United Patriot Coin can help steer you in the right direction. No obligation, just solid advice. Call now for your free guide, 844-202-7834.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson. I'm glad you joined us, and we're talking about diagnostics. And when we talk about feedlot setting, there's really 3 times where we would like to take samples, in my opinion. Okay, so this isn't everybody's opinion, but this is just mine in years of practice. The first is surveillance at arrival processing. The second is surveillance when we have some sort of pen outbreak. And the third one is at the dead pile. So our questions are, what are they bringing in? Why are they getting sick? Why'd they die? And we need to understand we're not always going to get an answer because there are, not all cows read the book. And sometimes we don't take samples early enough in the disease process or that. And so as we at Production Animal Consultation work with our crews, Dr. Toff Fredrickson, Dr. Jared Borick, many of our veterinarians are working day to day with our feedlot crews to certify people to take the proper samples. And so on the antemortem or alive samples at processing, when we have a pen outbreak or when we have an animal die, we're taking nasal swabs from these animals so that we can culture to see if there's viruses or bacteria that they're carrying. We'll take blood samples that can be used for serology after the animals have had an insult and we can see a spike in titers. We'll take ear notches to look for persistently infected BVD cattle. But the big tool we use today is those nasal swabs. And then what has really improved at our diagnostics labs, and we work with 3, Kansas State, Iowa State, and the University of Nebraska. When we send those in, we'll randomly take it across 5 cattle in the pen. Send those in, they'll do a pooled sample with polymerase chain reaction, which is PCR, okay? PCR, it used to be that we would take a sample, we would send in the diagnostic lab, they would do bacterial isolation, and then they do culture and sensitivity, and we'd get it back a week later, and the animal was either better or dead, and it was too late to make any kind of decisions. Today's technology, we can take samples today if we can get it to the diagnostic lab on these D labs that do a lot of bovine samples, we can get an answer back the next day. And we not only, with Nebraska, you not only get an answer back the next day on what the virals or the bacterial pathogens are, but you can also get antimicrobial resistance patterns in the bacteria that are isolated. So somebody's like, well, why haven't we taken diagnostic samples in the past? Or why don't we take them on a routine basis in feedlots? And I think part of the reason is how long an animal lives. When we have cattle that, from conception to consumption is 2 years. In a pig, it's less than a year. In a chicken, it's less than 4 months. And so the generational side of getting the answers and following the outcomes, we haven't been able to tie together. If we have these viruses, these are the outcomes. A 200 head pen of cattle today is worth $400,000. That's the equivalent of 10,000 feeder pigs. There isn't any vet on the world that was having an outbreak and 10,000 head of feeder pigs wouldn't be doing some sort of diagnostics for PED or PRRS. We need to be taking these samples at the time of surveillance on arrival, disease outbreak, and at the dead pile, start matching that with the outcomes so that we can start to get better answers. This is not a short-term project. This will take us 4 or 5, 10 years. We'll be planting some trees we'll never see the shade from. But if we will stay tight, stay hooked, and continue to work, we're going to get some great answers for our industry. We'll come back, we'll talk about postmortem.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
Hey folks, when we talk about intranasal products, Having the right nozzle is important, and Merck has a new, what they call CleanVax nozzle that's outstanding for administering Nasalgen. It has a nozzle that helps with the direction and application of the vaccine in the nose, and if you want to receive a free package of CleanVax nozzles, go to valleyvet.com, and between now through the end of September, anytime you order Nasalgen products and you use the promo code DocTalk, they will send you a free package of the CleanVax nozzles. Hope you're enjoying it, they work, and we'll see you down the road. Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
One animal has this huge impact on your operation.
BVDV is one of the most costly bovine diseases, with losses of $15 to $88 per head.
The virus will actually cross the placenta and get into the fetus. As it's developing, its immune system will recognize that virus as it's supposed to be here. And so then that's where our persistently infected animals come from. They're going to shed that virus their entire life, and then it's going to impact your operation.
It is important to work with your local veterinarian and partner with IDEXX for the best solution for your operation.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson. I'm glad you joined me. We're here at DocTalk. We appreciate you watching the show, and we've had a lot of fun. We're working towards 650th episode, and we secured sponsorship that, you know, we're going to be around for at least 700. So thank you for watching DocTalk. It's a lot of fun, and we love your emails, your Facebook, all the interaction. Thanks for what you do. We're talking about diagnostic sampling, and diagnostics will not give us all the answers, but the one thing that in our beef industry that I feel like we have to do is stop guessing. And what I mean by that is when we pull up and there's a pen of steers and they're not doing right, we can't guess what they have. We can't, I mean, we can get in broad generalities of bovine respiratory disease, but what are the things that are setting it off? It might not always be pathogenic, right? Or a pathogen. Remember, there's two reasons why animals get sick: an overwhelming dose of a pathogen or a suppressed immune system. So as long as we're doing the husbandry, the shelter, the comfort, the feeding, the doing the chores, and taking care of our animals, we shouldn't have the suppressed immune system. All of that is about keeping a body healthy and ready to fight off. When we're talking about vaccines and we're talking about diagnostics and we're talking about understanding the pathogen loads that these cattle are exposed to, that's where these diagnostics come in. So as we continue to improve management, as we continue to improve husbandry, it makes the diagnostics more applicable to a modern day facility and modern day practices in the beef industry. So we had to mature, we had to catch up with some of the other industries, but I think we're at that point. And so we talked about the antemortem samples. The next one's postmortem. And when we go out, being able to do a proper necropsy, being able to take the size of the sample from the right spot so that you have healthy tissue next to diseased tissue for histology, getting the proper sample so that if you're going to isolate pathogens, you can. Then whether you have fixed or fresh tissues, you need to work with your veterinarian who will know exactly what we want to have. And then when the postmortem's over and we have the samples, getting them, and I'll back up one step. We have to do the postmortem on an animal before it autolyzes or is too far gone, rots, summertime, whatever. We got to get good viable tissues. So doing it quickly is important. Get the right tissues, and then we want to have them fresh or fixed. Once we have those, keeping everything cool is important. And then getting them packaged appropriately and mailed quickly to get to the diagnostic lab so that they arrive in great shape is vital. I don't know how many times it's so frustrating to send in samples to have them say, oh, these were too autolyzed, we couldn't find anything. To go through all that work and send them in and then have them say, oh, sorry. And so This is a really, really important step. We have great ground transportation, air transportation to get them to the right diagnostic lab. So diagnostics aren't new, but we're entering a new era of the beef industry. These cattle are so valuable. Our husbandry practices just continue to prove. We have new wearable technologies to identify the right animals at the right time. Now, incorporating diagnostics with outcomes to know that what we see, what those outcomes or what potential interventions are, is just a natural next step for us. Thanks for watching DocTalk today. Remember, always work with your local veterinarian. And if you want to find us on the web, you can find us at www.doctalktv.com. I'm Dr. Dan Thomson with Production Animal Consultation, and I'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.